Yeah, so I already made this video, but there was like a weird feedback noise on it because the headphones were plugged in. I'm just gonna like jump into it. Advice for parents. Number one, don't freak out. You don't need to have like an aneurysm or a panic attack over it. Like it's not the end of the world. I mean, I can understand that it's your child, but unless they are dying, I really don't think you need to act as though they're dying because they're not. So that's the main thing, is just, be calm, because even if you can freak out internally or whatever, or just like worry about things, but if you show outwardly that you are overly upset by this, it's gonna affect them, because they're gonna think that it's wrong. Like, even if you say no, it's okay, they're still gonna see that you had like a negative reaction to it initially and think that it's a negative thing, and then in general, for anything, they're not going to want to come to you for things, because they're just going to think that you're going to get upset over it if they try to talk to you. So just being open to communication and just trying to, you know, put a bit of time in between when you actually react to things, instead of having like a knee-jerk reaction to what they say. Get into contact with people who are actually professionals that are experienced with these types of kids. You can find like a therapist or a psychiatrist that isn't experienced with it, and it can help some things, but it's not going to help with the situation, because if they don't have a background in it, they're not going to know how to deal with it. They're not going to have the best resources, and they could misdiagnose your kid with, either they could give a diagnosis that doesn't apply, or they could not give a diagnosis that does apply. So either way, it's pretty important that you get someone who knows what they're talking about. Also, don't be too quick to adhere to the idea that they necessarily are this way, like permanently, forever, because I mean, there's a fine line between not putting the idea like set in stone, and between respecting the idea for as long as it persists. I mean, at some point, if you have a kid who's saying that um, they're gonna pursue transition and everything from the time that they're 5, and they're still saying it when they're like a teenager, then obviously respect that until further notice, and it's probably gonna happen. But if you have like a 5-year-old who's saying it and they've just been saying it for like a month, then don't necessarily commit yourself to the idea that that's what their future is going to be, because it might not. So I think just committing yourself to supporting them regardless of what the outcome is the main goal, and not putting pressure on them to be one thing or the other. Realizing that not every person's perspective or situation is the same, I think, is a really important one, because if you look at the people on this channel, even like, and compare us, I mean, there's some people that I know what their views are, and that are very open with their views. I mean, I'm probably one of those people who's a little, not aggressive, but just like, I make my opinion known most of the time, or try to. And then there's some people who are a little bit more quiet about it, so it's hard to know. But there's even the people that are open with their opinions, it's very clear that, we're from different places. We have different ideas about things, and like, my experience wouldn't necessarily be the same as Emery's experience. So keeping that in mind, like, obviously my parents deal with me a certain way. If I had the same feelings as like Emery or August, because of the fact that they don't necessarily adhere to the binary completely, my parents would probably deal with that a lot differently. It would probably be a bit harder. I think it's harder for some people in general, unless they have the education, because they don't necessarily understand. My mom assumes certain things, and for me, they're true, most of them, but if I felt differently, then they wouldn't be, and I'd have to talk to her about that, and it might be difficult to talk to her about it. So just realizing that just because you've heard one person's story doesn't mean that if your child says something that they feel a certain way, that they're necessarily going to want to do all the things that you heard of that person doing or pursue certain things, because it might not be true. It might be completely different from what they want. And I don't think that you should try and convince them that they want something if they don't. I don't know, that's all I really have to say. I'm not a parent, so I'm not exactly the best person to ask. Honestly, think it really depends on a case-by-case basis. So